there's nothing that can match the joy of bringing a healthy child into the world. New mothers immediately have their lives altered as they adapt to caring for their little ones. However, many new and expectant mothers can be particularly prone to serious and even critical medical issues, especially regarding their cardiac health. Additionally, the rates of these occurrences have disproportionately affected populations in rural or potentially underserved communities. In a time period where the child's health has historically been prioritized, many realize there needs to be a concerted emphasis on the well-being of mom.
Some of the things that happen immediately postpartum while you're in the hospital is usually related to bleeding issues or postpartum hemorrhage. Those are the ones that we see we can address. The other ones that sometimes are a little bit more delayed in terms of presentation are related to the heart. That can show up in several ways in terms of preeclampsia, or if they've had chronic blood pressure issues, they can worsen and become concerning. And then cardiovascular issues, either they're pre-existing or they suddenly appear after delivery.
Women have a whole host of issues that they deal with during their pregnancy and right after pregnancy. Peripartum cardiomyopathy is actually a big one. That's when your heart muscle actually weakens, it gets a little dilated, and instead of pumping like a strong pump, it pumps very weakly like a big sac. A lot of these issues are genetic. There's certain populations that have some predispositions to it. Another issue that's a big one is hypertension during pregnancy. Preeclampsia, which is kind of an extreme case of that during pregnancy. During the pregnancy and right after the pregnancy, that can cause a lot of complications, including loss of the baby and loss of life for the mother.
The statistics showed that people in rural areas are poor, sicker. They do not have the resources of all the specialties that some of the larger areas have. So a lot of times the lack of resources in those areas for specialty care just not provided.
I already had high blood pressure prior to being pregnant. It was all managed well after my pregnancy, but 1 week after delivery, I started noticing changes in my body. I had difficulty sleeping. I couldn't lay down flat, and I had some fluid retention. My blood pressure was normal up until that point, and I remember my brother coming to visit with me, and he said that he noticed how swollen I was, even my nose, but I hadn't even really paid attention. I just knew that I was so tired that I couldn't hold my own son, and that evening I checked my blood pressure, and it was high, so I went to the ER, and the doctor did a chest x-ray and found fluid on my heart. The next morning, the doctor told me that I was diagnosed with postpartum heart failure, and that was difficult to hear since I'd just given birth to my first son and I had to leave him at home. That day, a cardiac nurse came and approached me about the Mom's Heart Matters program, and I was enrolled into the program prior to being discharged from the hospital. And with that program's guidance, I was able to create a better lifestyle for myself to minimize future damage.
The Mom's Heart Matters program, supported in Hinesville, Georgia by the Liberty Regional Medical Center, is a new creative solution to help curb postpartum medical problems in new mothers and was designed to save lives.
Depending on what people have in terms of access to care, it differs in different communities. There's also the feeling that if they're in a rural community, maybe the quality of the care may not be the same, and so they may not want to stay at home and do that. But I think with time and with programs like Mom's Heart Matters, we can demonstrate that the circle of care and the network that we can provide really is not just about the pregnancy, but what happens afterwards. And one of the really cool things about Mom's Heart Matters is our program and our monitoring and our resources don't stop at the end of the 6-week period. It doesn't stop at the end of 3 months. We actually are following our moms for the entire year.
The biggest misconception is once the baby is delivered, all is well. That actually is one of the most dangerous times for the mother and her heart right after the baby is delivered. The challenge here is to educate people that you got to take care of yourself. We have individual stories and data that suggests we're helping save moms' lives. And I think as people see that, there's going to be more buy-in with other physicians, other doctors, other nurses. What we have here that's really beautiful is a lot of commitment and a lot of energy that care a lot about this program.
I'll go in there and I'll explain the program and how important it is for med management and med compliance taking their medicine when they're supposed to, and we'll discuss the side effects. And if you don't take care of yourself like you're supposed to, what the consequences could be, since they do have preeclampsia and high blood pressures, the effects that could have on their bodies and their lifestyle if they did not take the medicines and be compliant, how important it is for them to do that. And we'll go through education, do their enrollment. We give them their blood pressure cuff. And those cuffs, as long as they have cell service, then we can see their blood pressure anywhere they are 24/7. We download the app to their phone with them. We go through how to take their pressure with the cuff. They take it in front of us, so they demonstrate how to use it. And then we make sure that they can see it on their phone.
We've actually seen the results and have had several patients say, I believe you saved my life. And we know that we've made a difference, that their cardiovascular disease has been maintained, if not prevented. And that's really our overall goal, is to make a difference in a patient's life.
To learn more about Liberty Regional Medical Center and for information on the Mom's Heart Matters program, visit online